Hello, I'm Dr. Paul Friedman.
And I'm Dawn Robertson. Providing the latest and highest quality technology with personal, compassionate service is our goal at St. Mary Mercy Hospital. We're sharing this video with you to help educate you about your surgical experience so you may achieve the most optimal surgical outcome.
We know that some patients feel nervous or even scared about surgery, and that's normal. Our skilled team of surgeons, anesthesiologists, nurses, and healthcare professionals all want you to have a positive experience at St. Mary Mercy, and we'll do our best to make your experience as comfortable and as stress-free as possible.
We hope to answer many of your questions about your procedure over the next few minutes and give you information to help you prepare for your operation and recovery.
While this video contains most of the information you need, every doctor's approach and each patient is unique.
If you have any questions along the way, please speak with your doctor, nurse, or any of our team members. We are here for you.
Thank you for choosing St. Mary Mercy Hospital.
As your surgery date approaches, there are several things you can do to prepare for your operation. By taking these few steps, you'll help promote a successful surgical outcome and speedy recovery. Physical activity will improve your blood flow and circulation, both essential during surgery and recovery. Eating a well-balanced diet and following a good nutrition plan will help promote natural wound healing. If you smoke, quitting or reducing your habit will reduce your chances of getting post-operative pneumonia. Within 2 weeks before your surgery, you'll receive a phone call from us to either schedule a pre-anesthesia interview at the hospital or schedule a phone interview. During this phone call, you'll be asked about your current medications and allergies. You'll be asked about your medical and surgical history. Having your medication bottles in front of you may be helpful. We'll confirm your surgery date and tell you which home medications may or may not be taken on the day of surgery. Most patients who'll be going home the day of surgery will have a phone interview with a registered nurse. If your pre-anesthesia testing interview is in person, you may have some labs and/or diagnostic tests done at that time. Every patient is unique. Following pre-anesthesia screening and testing, you may be given additional information or instructions. Those instructions may include seeing your primary care physician and/or your cardiologist. After 11 p.m. the day before your surgery, you cannot have anything to eat or drink. This includes candy, gum, and water. If you're a smoker, do not smoke at all the evening before or the day of your surgery. If your surgery is scheduled for after 12 noon, you'll be instructed as to what time you need to stop eating and drinking. You will need a responsible adult companion to accompany you the day of your surgery and to drive you home. Because of the anesthesia, you will not be able to drive 24 hours after leaving the hospital. It's also a good idea to confirm your arrangements with your companion the day before. On the day of your scheduled surgery, here are important things to remember. Please shower or bathe using an unscented or non-perfumed soap or body wash. Wash your hair. Do not put on any lotion, perfume, cologne, deodorant, and do not wear any makeup. Wear loose-fitting clothing. You may brush your teeth and gargle with mouthwash, but remember, do not eat anything, including breath mints, and do not chew any gum. Take only the medication you've been instructed to take, and take them only with a sip of water. Leave your valuables like jewelry, purses, wallets, cash, and credit cards at home. You do not need your ID or your insurance card. Bring your glasses and hearing aids. Leave your contacts at home. If you must wear your contacts, bring your storage container. You will be asked to remove them prior to surgery. You'll also be asked to remove any dentures or removable dental work, body piercings, wigs, hairpins, hair clips, or wedding rings prior to surgery, so you may want to leave those home too. Do bring crutches, your walker, or your cane if you use an assistive device for walking. If you are being admitted after surgery, you are welcome to bring the following items: pajamas, robe, and slippers, although hospital pajamas and gowns are available. Comfortable walking shoes, if needed for walking after surgery. Personal toiletries, and your CPAP machine if you use one for sleep apnea. As a courtesy, we will check your machine to ensure proper functioning. You and your responsible companion should arrive at the hospital at your appointed time, which will be an hour to an hour and a half prior to surgery. Enter the hospital grounds at the entrance off of Levan Road and enter the hospital through the south entrance. If you require a wheelchair, there will be one waiting by the south entrance. Valet service is offered for a nominal fee. After entering at the south entrance, take elevator B to the second floor and check in at the registration desk just under the Outpatient Center sign. From there, you'll be directed either to the surgical waiting area or to pre-anesthesia for further testing. Once you're in the surgical waiting area, you can confirm your arrival with the receptionist, who will give you a brief orientation and introduce you to the surgical services tracking board. The tracking board allows your companion to follow your progress through pre-op, surgery, and recovery. Each patient is assigned a tracking number, and only the numbers appear on the screens to ensure confidentiality. Your companion can leave a cell number with the receptionist or use our restaurant-style pager that'll work anywhere inside the hospital. When your name is called, you'll be escorted to the pre-operative unit by a member of your surgical team. Companions will need to wait for the first part of the preoperative care, which typically takes 40 to 45 minutes. Once you're in the preoperative room, your height and weight will be verified. Your vitals will be taken. You'll be asked to use the restroom and change into a surgical hat and gown. You'll be given a bag for your personal belongings. For your safety, it is our routine procedure to verify your information several times before your surgery. Questions may include, what is your name and birth date? What kind of surgery are you having, and on what part of the body is the operation? If you have not already signed a general consent and/or surgical consent form, you'll be asked to do so. Please take the time to review the forms and confirm that the surgeon and procedure are accurately stated. While in pre-op, a nurse may shave the surgical site and start an IV. You may also have sequential compression devices applied to your legs. These are stockings like sleeves that'll squeeze and massage your legs during surgery to promote blood flow and help prevent blood clots. Also in pre-op, you'll meet the anesthesiologist and nurse anesthetist, both of whom will ensure that you're safe and comfortable in surgery. You may be given some IV medication to relax you before you go to surgery. Your surgeon will stop in to talk to you and answer any last-minute questions. Your surgical site may be marked at this time. Once you've had your initial meetings with the surgical team and received any necessary medications, your companion will be allowed to stay by your side until you are wheeled into your surgical suite. By then, you'll have learned the approximate length of the surgery, so your companion will be able to plan for his or her wait time appropriately. Most patients' last memory is of leaving the pre-op unit and then waking up in the recovery room with their surgery completed. During your surgery, companions will be able to receive updates about you on the patient tracking board. While waiting, companions are welcome to use the beverage and snack station in the waiting area or visit the hospital cafe, gift shop, chapel, or coffee cart. Campus maps are available from the receptionist to help guide you through our facility. Your companion should carry a cell phone or the provided pager when traveling outside the waiting area in order to be reached with any updates. It's also helpful if your companion informs the receptionist upon leaving the waiting room. Following surgery, your surgeon will speak with your companion. Based on the type of surgery and anesthetic you received, you will either go to the Phase 1 main recovery room or the Phase 2 outpatient recovery room. If you're in the Phase 1 recovery room, your nurse will monitor you continuously and give you IV medication to help ease the pain and ensure your comfort. Following anesthesia, it's not unusual to experience chills or for sounds to seem louder. It's also common for time to go by quickly. You'll be medicated for pain, and your nurse will make sure that you're comfortable. Your nurse will also encourage you to take deep breaths and cough. Companions are not allowed in the Phase 1 main recovery room. The minimum stay in the Phase 1 recovery room is 1 hour, though longer recovery may be needed and is not unusual. If you're being admitted, you will move from Phase 1 recovery to your room. The receptionist will provide your companion with your room number. If you're leaving on the same day of surgery, your anesthesiologist will determine when it's time for you to move to the Phase 2 outpatient recovery room. Once you're stable and alert in Phase 2, you'll be offered a beverage and maybe food, then given discharge instructions. While in Phase 2, your companion will be invited to join you. All surgical patients who are admitted are taken to the South Wing. Your room at St. Mary Mercy Hospital is private and has been designed with your comfort and convenience in mind. Once you get to your room, you'll meet the nurse who will be caring for you. The nurse will assess you and ensure that you're comfortable. You may be asked several questions about how you feel to assess your pain level. You may still have your sequential compression devices on your legs to promote circulation. You'll also learn a few tasks that you should perform in order to aid your healing. You'll be taught to cough and breathe deeply. This will help clear your lungs and decrease your chances of getting pneumonia. If your surgery is abdominal, you'll be taught to use a pillow to splint your incision while you cough or breathe deeply. This will decrease pain at your incision site. You'll also be taught to use an instrument called an incentive spirometer. This is a device which helps you inhale deeply to expand your lungs. It will also decrease your chances of getting pneumonia. You'll be encouraged to get out of bed, preferably on the same day as surgery. Simply taking a walk down the hall will help your blood circulate. Our patient care associates will be available to assist you. Depending on your doctor's order during your hospital stay, you'll likely be given 1 or more daily shots of heparin, a blood thinner medication. This medication is important to prevent you from getting a blood clot in your legs or lungs. Companions who wish to visit during your stay should use elevator D from the south entrance to get to the patient floors in the South Wing. That's done by entering at the south entrance, walking to the main lobby, and following the large hallway on the left. If your companion would like to rest or sleep while visiting, the sofa in the room converts to a bed. When your medical team feels that you're well enough to return home, you'll be discharged. Your companion will participate in reviewing your discharge instructions and any prescriptions. A written copy will be provided and any questions will be answered. Before you leave the hospital, your doctor and nurse will teach you some very important tasks to complete as you continue to heal at home. It is important that your companion relays your discharge information to you once you're alert at home. Your nurse will review your medications that you'll be taking at home. You'll be instructed on diet, activity level, bathing, and wound care. Finally, you'll be given information on a follow-up visit with your surgeon, usually within a week of surgery. When you're ready to go home, your companion can drive to the south entrance, and a patient care associate will escort you to your waiting car. Remember, you will not be able to drive home.
Thank you for watching this surgical experience video. We sincerely hope you found it to be helpful. If you have any further questions or concerns, please call the hospital main number and your call will be directed appropriately.
Thank you for choosing St. Mary Mercy Hospital and entrusting us to perform your surgical procedure. We take your decision very seriously and believe it is a privilege to care for you. We are confident that you will receive the very best, comprehensive, and compassionate care during your stay. Thank you.